Well, welcome to our final week, and we'll be in chapter 13, where we're looking at the professional organizations related to health and fitness psychology and also ethics. So let's get started. When we consider a profession, one of the things a profession will be organizations that will help provide structure, growth, will provide current research, conferences, research journals. So it will be made up of individuals who are within that profession and want to meet a certain set of standards for that profession. And so that's what this chapter is addressing. Pretty much the importance of professional groups and also ethical standards, specifically for those of us in the area of health, fitness, psychology. What profession you decide to pursue, there will be professional organizations that will be there to help promote growth and development and recognition of expertise that you have acquired a level of education, you've acquired a level of expertise in that field, so then you can be considered a professional. The textbook does give you a nice overview of various professional organizations that will be related to the area of health, fitness, psychology. The one that's the most well known and probably most popular, it's the largest sports medicine and exercise science organization, is the ACSM, the American College of Sports Medicine. I'm sure you're familiar with that group. Great organization. And if you're in the area of health, fitness, psychology, it's one that you should be involved with. There are others listed in this chapter. Again, good professional organizations. I would recommend that you go through each one and get a sense of what their main focus goal is, depending on your area of interest. For instance, if you're in area of sport, and I know I have some in this class who are coaches, the North American Society for Psychology and Sport Physical Activity is an excellent one. If you're gearing a little more towards psychology, the American Psychological Association has divisions within it that relates to health, fitness, and also sports psychology. So again, I just recommend that you go through these different professional groups and see which ones may meet your professional goals. Looking at it is to consider the 5 professional areas that applied health, fitness, psychology would have connections with. Obviously, psychology, sport and exercise psychology, those of you interested in sports medicine, behavioral medicine, and also the area of health. So again, just important for you to kind of find your niche, which areas specifically of health, fitness, psychology are you interested in? One of these professional groups or organizations will have a code of ethics. And in each one of these codes, there are some common core values, ethics that are stated. First of all, just the idea that the group exists to help to improve and to disseminate public knowledge about the benefits of professional expertise. And also, the group wants to maintain high professional and scientific standards and to be reputable, not to collaborate with people who might violate those standards. These professional organizations, as they develop this code of ethics, they're just trying to safeguard the public and safeguard their organization against anyone who might fall short of ethical conduct. And it's important in any profession that ethics are followed and there's an expectation of a level of ethical behavior among the members. And obviously, there's a importance of improving the health and well-being of the people, the community, and society as it relates to professional organizations in our field. Professional ethics really, it's the moral component of any professional practice, and it's basically a set of principles that would suggest a particular code of conduct in our area, specifically as relates to fitness psychology. It's a guidelines of what is acceptable, what's not acceptable, what would be predetermined expectation for someone who's a practicing professional in our field. Professional ethics would include having accountability, making sure you're selecting appropriate performance enhancement techniques, that you're using psychological inventories correctly, that you're dealing with individuals based on their individual needs and differences, that you're staying current in the field, and also that you know when to and to whom should you refer someone to. If you're working with a client who may show signs of an eating disorder, it's really time then to get a professional who is specifically trained and qualified and certified in the area of eating disorders to help you. So it's just important to know what's your level of expertise and when is it necessarily to get other people involved with your client. So as we finish up this chapter, we do get into credentialing and what that actually involves. And it's a term that's used to describe a process somebody goes through in order to meet predetermined standards. And there's subcomponents to credentialing, three different ones: licensure, certification, and registry. Licensure would deal more with a psychologist, someone who's licensed to advertise and market and use the title of a psychologist within a certain state or a country in which they practice. And so within the United States, in order to be a licensed psychologist, there's several criteria that has to be met with a doctorate program that's sanctioned by APA. And so in order for a person to be considered a psychologist, there's a certain level that needs to be obtained. The title of a licensed psychologist is legally protected, and only those individuals that actually have met the criteria can use that title. And they may refer to themselves as sports psychologists, health psychologists, fitness or exercise psychologists. But again, it's a protected word that means you've met the rigorous requirements of a psychologist. The exception would be if you're practicing in a university or college setting and you're not in the community. When we talk about certification, it's the idea that you have completed certain criteria, a certain level of education, training to carry out a specific service. The example from the AASP, which is the Association of Applied Sports Psychology, they can use the title of a consultant, certified consultant, but they have to complete specific courses or programs. They have a certain number of hours of supervision. And so there's a list of criteria in order for certification to be obtained. Registry is just doesn't really have any legal control or implications. It's not really controlled by credentialing groups, but it just does indicate professional recognition. Being a professional, much of your preparation will determine that direction, right? Your undergraduate major, if you go on for a master's degree, lots of different employment options in the area of health and fitness, lots of different things that you can become qualified to do. So my recommendation is to select the areas that you're most interested in, get trained, find out what level of expertise you need to develop so you can pursue the path that you're most interested in.